Hello and welcome to the information session for the Dental Hygiene program at Lone Star College-Kingwood. My name is Christy Dalton and I'm the Program Director for the Dental Hygiene Department. We are going to talk about our program's admission process, but first I would like to provide a little history of our program. Our program started in 2004 and we graduated our first class in 2006. We are very proud to say that since the beginning of our program, our students have had a 100% pass rate on all of their boards, and we're very proud of the difference they are making in the community. So what does a dental hygienist do? Dental hygienists evaluate the patient's overall health as it relates to their oral health. We evaluate medical histories and expose patients to radiographs or take x-rays. We do intraoral imaging or photographs to help with diagnosing. We perform intra and extraoral cancer screening as well as clean the patient's teeth. We also perform non-surgical periodontal therapy for a patient with gum disease. And another important responsibility the dental hygienist performs is educating patients on oral health, nutrition, and overall health. Our program is accredited by the Commission on Dental Accreditation. This is very important because in the state of Texas, in order to become a licensed dental hygienist, you must pass 2 board exams. A national board exam, which is a written exam, and a clinical board exam, which is a practical exam. And you must graduate from a dental hygiene program that is accredited by the Commission on Dental Accreditation. Our program offers a 68-hour program that culminates in an Associate of Applied Science degree. It is a full-time daytime program. We typically say students will be here from 8 to 5, Monday through Friday. It's over 5 semesters, which includes 1 summer semester. For this reason, it's recommended that you do not try to work while you're in the program. It's certainly not possible to work full-time. It may be possible to work very part-time. We do have a fully functional dental clinic on site where we treat patients to complete the clinical requirements that are within the program. We use these 3 outside rotation sites in your final 2 semesters to increase your exposure to diverse patients. Our students go to the Interfaith Community Clinic in the Woodlands, Tamagua in Tomball, and Harris County Health Department Clinic in Humble. Students are required to have their own transportation to these external rotation sites. In order to apply for the program, you must complete a few prerequisite courses. The prerequisites are courses that absolutely have to be completed prior to applying. In fact, the system will not even allow you to apply unless you've completed these courses. The prerequisite courses include Chemistry 1405 or 1411, English 1301, Sociology 1301, and Biology 2401, which is Anatomy and Physiology 1. Make sure on the chemistry and biology courses you have taken the lecture and lab portions, which would equal 4 credit hours for each of those courses. These 4 courses must be completed by December 31st of the year prior to the application in order to be considered. In addition to the prerequisite courses, there are 5 general education courses that are required within our degree plan. They must be taken prior to graduating from our program. However, we do recommend that you take these before you apply, and there's a couple reasons for that. First, it gets them out of the way. If you take them before you apply, you don't have to worry about taking them while you're also taking challenging dental hygiene courses. The other reason you would want to take them before you apply is you get points on your application score sheet if you've completed these prior to the application. Our application is extremely competitive, and the more points you have, the better your odds are for acceptance into the program. We typically have around 250 qualified applicants for 24 spots, so you want to do all that you can to make your application as competitive as possible. Applicants often ask, what happens if I started college years ago and it's been a while since I had these courses? Do I have to retake all of my coursework? The answer is typically no, with the exception of the biology courses. We do require that all the biology courses be taken within the last 5 years. That's going to include Anatomy and Physiology 1 and 2 and Medical Microbiology. So if you did take these more than 5 years prior to your application, there are various ways to refresh those courses to make them current. Here's a slide that shows the options to refresh those biology courses if you need, and you're always able to contact us if you have any questions concerning this topic. In order to apply to our program, you must be at least 18 years of age at the time of the application. You will want to apply to Lone Star College first. you need to submit all transcripts from every college or university that you have ever attended to Lone Star College Admissions Office. You want to be sure this is done prior to applying to the dental hygiene program. If you are a Lone Star student and have never attended a different college, you don't need to worry about this. All of your transcripts are already going to be in the system. For those of you that are submitting transcripts, please submit those to the college well in advance of the application. If you know you're going to apply next year, I would recommend that you have those transcripts sent at the end of every semester as soon as grades are posted. It's best to have them sent by January 1st to give the college time to evaluate them. If you are a full transfer student from a university, the course numbers are going to be different. Because of this, it's likely that you will need to contact us during the application period to make sure that your GPA is calculated on your score sheet, because it may show up on your application that your GPA is 0. So just contact us and we will make sure that this gets fixed in the system. The dental hygiene application is a separate application than the application for Lone Star College and is fully online, which makes it really easy to complete. We do require that our applicants do 20 hours of observing a dental hygienist. The hours will be valid for up to 3 years. It is important that you observe the hygienist, not the dentist, not the assistant, not the front office. If you currently work in a dental office, the observation hours cannot be obtained from that office. You will need to find another office to observe in. There is a form on our website that you will use that the dental hygienist will sign each time that you observe. This must be submitted on our form to receive credit. The final requirement for our application is that you must take an entrance test. It's called the Health Science Reasoning Test. On the first day of the application, you'll find directions for registering for it on our dental hygiene website. It costs $15 and you will pay for it at the link provided on our page. You will take this test at home on your own device. Be sure that you have good internet connection, as we are not responsible for any connection or computer issues during the test. You will have from 7 a.m. to 4 p.m. on the test date you select to complete the exam. The scores from your test will be entered onto your score sheet by us within 2 days following the date you took the exam. Please understand it'll take a couple of days for us to receive the scores and transfer them to your score sheet. So if you don't see your score right away, don't worry. Allow us a couple of days to complete this process. This test may only be taken once per application. Even if you took it last year for the application, you must take it again, and we will only take the score from the current year. This test is a little different for those of you who have never taken it or never heard of it. There's nothing really to study or prepare for it. It does not measure how much you know about math, science, English, or history. But what it does is it tries to measure your ability to be a critical thinker. So the questions on the test are scenarios that you have to answer questions about, and this shows how well you are able to reason through a problem. In healthcare, it's very important to be able to apply the knowledge you've learned and to make decisions based on reasoning. So that's why we use this test. It's a 33-item test, and it is timed. You have 50 minutes to take the test. It's important to know that if you do not answer a question, it will be counted incorrect. So you want to finish all the questions, but you don't want to rush through the test. Be sure and watch your time and do your best to just answer the questions without spending too much time on any one question. Our application period each year runs from the third Wednesday in January until the first Wednesday in March. When the application is available, it will have an active link on our website where you can access it. During the application period, please check your Lone Star email at least once a week. If something is submitted incorrectly, your application will be unsubmitted, and we will send you an email on what you need to correct. If your application is submitted the night before the deadline, I suggest you check your email frequently on the final day. If the correct documents are not uploaded by 4 p.m. on the final day, you will not be considered for that application period. For this reason, I recommend you not wait until the last day to apply for the program. We use a score sheet to rank applicants, and we're going to talk a little bit about that now. There are 3 sections on the score sheet: your prerequisite GPA, points for your general education courses, and points for the HSRT exam. Each section has a maximum of 4 points. Let's look at the actual score sheet now. The first section is your prerequisite GPA, which a maximum is 4.0. So if you had A's in all of your prerequisite courses, you would have 4 points in that category. There's a description there on how to calculate your GPA if you don't know how to. So if you have some A's and some B's, you could have 3.5 points in that category, depending on what your actual GPA was on those prerequisites. The second category is the general education courses. You get points for A's, B's, and C's. So you get 4 points for an A, 3 points for a B, and 2 points for a C. And depending on how many courses and what grade you earned, you'll get points in that category. If you have 17 to 20 points, you'll get the full 4 points on the score sheet. 12 to 16 points, you'll get 3, and so on. So you can see why it's important to complete as many of those courses and get good grades, because you'll get more points. All of the prerequisite and co-requisite courses must be a C or higher to apply. The third category is the health science reasoning test. This is not a pass-fail test. You get points for what you score on the test. Remember, it is a 33-item test, so the maximum score is 33. If you score between 29 and 33, you'll get 4 points in that category. Between 25 and 28, 3 points, and so on. Below 15 on the HSRT test, you will get 0 points in that category. I will share that most people do not score 4 points on the health science reasoning test in that category. Very few applicants score that high, so don't think you have to have the maximum points in every category in order to be accepted. There's a maximum of 12 points on the score sheet. Last year, our lowest score was a 10. In previous years, it was a 9.41. It varies every year depending on the applicant pool, and some people might get 12 on the score sheet, but most people do not. So don't think you have to have a perfect score sheet in order to apply. Let's talk about repeated courses. So we know that life does not stop while you're in college and things happen. You might be enrolled in a course, something happens, and you're not able to be successful in that course, and we understand that. So we do allow one free retake of a course in order to try to improve your grade. So if you take it one semester and you get a D, and then you retake it and get an A, we take the A. But what you can't do is retake it multiple times, because then you'll get points deducted. If you retake a course more than twice, you will have half a point deducted from your final score on your score sheet. You can retake a course one time, but more than that, and you'll have points taken off for each time you retake it. So what happens next? After all the applications are in the system, we rank the applicants from highest to lowest, and at that time, the top 32 applicants will be invited for an interview. If there's a tie for that 32nd spot, all who are tied at that spot will also be invited for an interview. After the interview, the top 24 applicants are invited to accept a position in the program for the following fall. Admission into the program is conditional upon a negative background check and drug test. You have a very strict background check that the State Board of Dental Examiners will be administering when you graduate to get your license. If there is anything that is in your background that could prevent you from being licensed as a dental hygienist in the state of Texas, you should contact the State Board to have them run a background check to make sure that there's nothing that will keep you from getting a license. You don't want to go all the way through the 2-year program and all that money and then not be able to get licensed. Lone Star College is not responsible for any student not able to get licensed in the state upon graduation. Here is the information for the State Board if you need it. Additionally, we do not require proof of immunization prior to the application, but here's a list of the immunizations that you will need before you start the program. The main reason I mention this is that the hepatitis B vaccine is a 2 or 3 series vaccine that takes about 7 months to complete. So if you wait until you're accepted into the program, you will not have time to complete that series prior to the start of the program, and it must be completed before the first day of class. So it's best to get that out of the way. Many of you probably already had that, and it does not have to be repeated if you had it as a child. If for some reason you do not have proof of your immunizations, you can go to your doctor or a clinic, and they can check your titers to prove immunity, and that will be sufficient. The TB skin test is good for 1 year and will need to be completed when it expires during the program, so you can wait to be sure that you're accepted before completing that if you would like. Lone Star College Dental Hygiene Program does adhere to all the current guidelines from CDC and other organizations to make sure that our students, faculty, staff, and patients are safe. We maintain all current standards for infection control to prevent bloodborne infections as well as respiratory infections. Now, how much does the program cost? Our program is more expensive than getting an Associate of Arts degree. We have a very extensive dental clinic and have expensive equipment and instruments, so the cost is a little higher. Our students purchase their own instruments and supplies, and the estimate is about $15,200 for the 2 years. The first semester is more expensive because that's when you will purchase your instrument kit, so it will be about $8,200. And then the remaining $7,000 is throughout your time here. In the second year, some of the big expenses are the board exams to get your license, and that $7,000 does include those costs. The clinical board exam is about $1,200, and the written exam is around $450. We know these are expensive items. It's not just tuition and fees. You certainly have additional costs, and we like you to know that up front because it's very important that you're prepared financially before you start the program. We have had students who naively just thought it would take care of itself, and their biggest stress was not the coursework or the clinical work, but it was, how do I pay for this? And it really impacted their ability to be successful. I want you to also be aware, if you have financial aid, that the instruments and supplies must be paid for in the first week of class, and this is not able to come directly out of financial aid like tuition and books. If you have leftover financial aid, it will be dispersed to you later in the semester. So you need to have another way to cover these costs until then. Our students do treat patients in our clinic. We have a screening procedure where patients for the community can come in and be screened as patients, which is great because it is serving the community, and it also provides our students with patients. We do ask that students bring in their own patients for clinical experience, so that'll be your friends, family, neighbors, or whoever you can get in to be your patient. We help provide patients, but we can't guarantee that we will provide you all the patients you need for your clinical experiences. So this is why you need to be thinking ahead of individuals that you can utilize as patients. I want to share an opportunity that we have for our students. We have a partnership with Texas Women's University that allows our students to obtain their Bachelor of Science in Dental Hygiene at the same time as their Associate of Applied Science in Dental Hygiene. This is fairly unique to our college. Not all community college programs are able to offer this, and it's a great opportunity. You might ask, why would I want a bachelor's degree in dental hygiene? Now, if your only goal is to practice clinical hygiene, then there's probably no reason to get a bachelor's degree, except you just might want that as a personal goal. You are not going to earn a higher salary practicing clinical dental hygiene if you have a higher degree. You're typically paid the same if you have an associate's degree or a master's degree. However, if you have additional goals such as teaching, working in research, or in sales for a dental company, or also some of the managed dental companies have hygiene managers that need to have a bachelor's degree, you might want to take advantage of this option while you're in our program. So what does this program look like? You must already have completed or be nearly complete with your associate's degree so that you are core complete in Texas. This means that you would have taken the majority of your 2 English, 2 history, 2 government, your humanities, and fine arts. All of the courses that are required to be core complete in Texas to get that bachelor's degree. If you're lacking a few of these courses, you can still participate in the program. As far as tuition, you will pay TWU for their courses, and you will pay Lone Star for courses you take through us. You might get financial aid through TWU, or you might get the financial aid through us. Although with that many hours completed, it's unlikely that you would be eligible for financial aid through us. TWU does require a prerequisite that may not be in those core courses. That course is Math 1342, which is statistics. It is required before you enter the TWU program, so it would be good to look at that if it's something you're interested in. You might try and get that out of the way in anticipation of being in that program. The curriculum at TWU is going to be supplemental to the coursework here. It's going to enrich your clinical and didactic work in our program. Here's a list of some of the courses that you might be taking. So you can see it's a lot of theory courses since you will not be doing hands-on in that online program. We have had many students who completed it and been successful. It does mean extra work, but every student that has participated in this program has always said, yes, it was worth it. You can also, instead of doing the entire dual program in the 2 years, you can spread out the TWU portion and finish it sometime after graduating from our program. I encourage you to look at all the information on our main dental hygiene page and also on the link to the right of that page labeled Additional Dental Hygiene Program Requirements. Thank you for joining me to learn more about our program. If you have any questions, please feel free to contact me. Here is the access code you will need to put on your application. Please be sure and submit this on the correct form or it will be rejected. Thank you again and all the best.